Welcome to this instructional video demonstrating a below-knee amputation. In our orthopedic trauma practice, an amputation may occur following an injury that causes extensive damage to skin, nerve, muscle, and blood vessels. This is a look at skin breakdown due to lack of sufficient blood flow into the foot and ankle. Prior to incision, we use a skin marker to outline our incisional path. This template is important in our surgical planning to ensure that we leave adequate soft tissues to close the wound at the end of surgery. We use an electrocautery knife to help dissect through muscle and tissue to expose the bony surfaces. Using a scalpel, we complete the circumferential incision around the leg. Now that the main incisions and dissection have taken place, we use a suture to tie off predominant blood vessel bundles to prevent bleeding. Before surgery began, a tourniquet was placed on the upper thigh to help control bleeding. As the amputation progresses, the tourniquet will be released to assess blood flow. Using the sutures to tie off large blood vessels helps to mitigate blood loss. An elevator tool is used to directly clear away adherent tissue from the tibia and the fibula as we prepare to remove the lower leg. A surgical saw is used to cut the bone. This is followed by an extremely sharp tissue knife that completes the rest of the below-knee amputation. At this point, the tourniquet on the thigh is released to assess bleeding. We use another suture to tie off a blood vessel. Using sterile saline, we do a preliminary wash of the tissues to minimize infection and clear away debris. Moving back to the bony surface of the tibia, we use the bone saw as a file to remove any and all sharp ridges on the bone. The tibia is the main weight-bearing center when using a prosthetic leg. and we want the weight-bearing surface to be as smooth and comfortable as possible. Muscle and other tissue are thinned out and excised as we move to the final closure of the wound. For this part of the closure, we use strong dissolvable suture to approximate the deepest layers of tissue. Before the deepest stitch layer is complete, a drain is inserted. This drain helps to evacuate blood that would otherwise form a large hematoma at the end of the surgical site. With the drain in place, we use more dissolvable suture to close the subcutaneous tissues. On the most superficial layer of skin, we use a nylon suture to conclude the below-knee amputation surgery. We advise patients to avoid bearing weight on this limb for 6 weeks. During that time, patients work with the prosthetics team to optimize skin healing and prepare for their return to physical activity.